Monsieur Duclos, on peut commencer?
Bonjour tout le monde, merci d'être à l'écoute. Je salue mes collègues qui vont bientôt vouloir présenter certaines informations suite au point de presse du premier ministre Trudeau. Nous allons commencer par la ministre ANAND, qui est la ministre de l'Approvisionnement et des Services publics du gouvernement canadien. Nous entendrons aussi la docteure Theresa Tam, qui est la ministre en chef de l'Agence de la santé publique du gouvernement canadien, ainsi que le docteur Njoo, qui est l'administrateur en chef adjoint de la santé publique au Canada. Nous entendrons aussi le major général Fortin, qui est responsable du déploiement au sein du Centre national des opérations, ainsi que la docteure SHARMA, qui est conseillère médicale en chef de Santé Canada. Avant de passer la parole à ma collègue ministre ANAND, j'aimerais tout d'abord rappeler certains des points importants que le premier ministre Trudeau a partagés il y a quelques instants. Tout d'abord, un message d'empathie et de sympathie à l'endroit de nos voisins et de nos alliés américains qui vivent des moments difficiles pour leurs institutions démocratiques. Aussi un message de sympathie à l'endroit des familles et des proches des victimes du vol 752 qui a été abattu il y a un an en Iran. Donc, des moments sombres que vivent beaucoup de gens à la fois ici au Canada et aux États-Unis. Ceci étant dit, nous avons aussi entendu de la part du premier ministre Trudeau un message solide d'entraide et de collaboration au sein de notre fédération canadienne. And for this reason, I would like now to turn to Minister Anand, who will provide us remarks on the vaccine delivery and administration within Canada.
Merci beaucoup, Jean-Yves, et bonjour. Avant de commencer, je voudrais remercier tous les gens. Je m'excuse. Je voudrais remercier tous les gens sur la première ligne pour leur travail important. I want to thank sincerely the health professionals across the country for their work as they continue to protect Canadians on the front lines. 2020 was extremely hard on so many fronts. And while we begin 2021 in the midst of a very serious situation, one that requires more resolve and sacrifice than ever before, we have real reason for hope. Aujourd'hui, je voudrais prendre quelques instants pour parler. Today, we would like to take a few moments to update Canadians with regards to vaccines. I want to start by saying, while Canada has secured one of the most diverse and robust vaccine portfolios, we are now focused on getting doses into Canada at the earliest possible moment. That is precisely what we did last month when we secured early delivery of the Moderna and Pfizer-BioNTech vaccines, just as they were being authorized by Health Canada. Vaccine doses are now arriving at a steady pace, and we are on track to receive a total of over 1 million doses by the end of this month. I know many of us would like to see that rhythm increase. The rate of vaccine deliveries is increasing and will continue. We are on track to receive 6 million doses by the end of March, 1.3 million doses of those by the end of January, 1.9 million doses by the end of February. These deliveries are being made on a schedule shared publicly and with the provinces. And Major General Tam will expand on the delivery numbers in a moment. PHAC is publishing the deliveries, sharing those schedules with the provinces and territories. I want to assure Canadians that I, along with my colleagues at PSPC, are working nonstop to accelerate vaccine delivery schedules. Due to the earlier start of the deliveries in December, we are well on track to receive enough vaccines for everyone by the end of September. And let's remember, we are now at the beginning of January. I believe it is also important to remember that all of us at every level of government, in opposition, in media, and across the country, want the same thing: an end to the pandemic and a return to our normal lives. We are pushing the exact same direction, and we must continue to collaborate. Together, we will get through this. Thank you.
Thank you, Minister Anand. Dr. Tam, please.
And good afternoon. Bonjour à toutes et tous. There have been over 635,000 cases of COVID-19 in Canada, including 16,579 deaths and over 80,250 active cases across the country. Nationally, the average case count is at 7,672 new cases being reported daily over the past week, and the number of people experiencing severe illness continues to increase. There are an average of 4,336 individuals with COVID-19 being treated in Canadian hospitals, and over 800 of whom are in critical care. And 136 deaths are being reported each day. Canada continues to monitor for virus variants that may be associated with an increased risk of spread. To date, there have been 14 cases of a variant virus first reported in the UK, United Kingdom. As the rollout of COVID-19 vaccines proceeds across Canada, including during this initial phase to protect those at highest risk of severe outcomes or exposure, keeping Canadians up to date with timely, factual information is a top priority. The Public Health Agency of Canada is working closely with provinces and territories, Health Canada regulators, and other federal jurisdictions to collect information on COVID-19 vaccine safety. Starting today, the information will be posted on canada.ca and updated weekly on Friday afternoons. The weekly COVID-19 vaccine safety report will include information on adverse events following immunization, which involve any health problem that happens following immunization, but is not necessarily caused by the vaccine. Adverse events can range from common mild events such as soreness at the site of injection or a slight fever to more rare serious events such as a severe allergic reaction. Canada has a robust vaccine safety monitoring system in place, and all serious events will be investigated. As of January 1, there have been over 1,015,000 doses of COVID-19 vaccines administered across Canada, with 9 adverse events reported. There have been no unexpected vaccine safety issues identified to date. As with any new undertaking, we all have questions. These weekly reports on COVID-19 vaccine safety aim to provide Canadians with regular access to credible information that will assist them in making informed and confident decisions on vaccination for themselves and their families. As always, I call on healthcare providers to listen to Canadians' questions and concerns and to encourage ongoing dialogue to further support vaccine confidence. The progress we have made across Canada and around the world on vaccines is inspirational, but everything we've achieved is the result of consistent, persistent, and collective efforts. We've worked hard and we've kept up the pace. Though I know we are all eagerly awaiting more hopeful days ahead, we've still got a ways to go. We all need to maintain core public health practices, hand washing, masking, and spacing away any and all opportunities for COVID-19 to spread. and we wait for our place in the vaccine, as we wait for our place in the vaccine queue, let's continue to support those who need to be protected most urgently and do our part to help all those working to make vaccines available for all Canadians in the months ahead. Thank you.
Bonjour à tous et à toutes. Il y a eu plus de 635 000 cas de COVID-19 au Canada, dont 16 579 décès. À l'échelle nationale, il y a plus de 80 250 cas actifs et 7 672 nouveaux cas ont été signalés en moyenne chaque jour au cours de la semaine dernière. Le nombre de personnes gravement malades continue d'augmenter. En moyenne, 4 336 personnes atteintes de la COVID-19 sont traitées dans les hôpitaux canadiens, dont plus de 800 se trouvent aux soins intensifs. De plus, 136 décès ont été signalés chaque jour. Le Canada continue de surveiller l'émergence de variants du virus qui pourraient être associés à un risque de propagation accrue. À ce jour, on a signalé 14 cas de variants du virus détectés au Royaume-Uni. Alors que la campagne de vaccination contre la COVID-19 se poursuit partout au Canada, y compris la phase initiale visant à protéger les personnes les plus à risque de complications graves ou d'exposition, la priorité absolue est de tenir les Canadiens informés en temps utile et de manière factuelle. L'Agence de la santé publique du Canada travaille en étroite collaboration avec les provinces, les territoires, les autorités de réglementation de Santé Canada et d'autres administrations fédérales pour recueillir des renseignements sur l'innocuité des vaccins contre la COVID-19. À compter d'aujourd'hui, l'information sera affichée sur canada.ca et mise à jour chaque semaine le vendredi après-midi. Le rapport hebdomadaire sur l'innocuité des vaccins contre la COVID-19 renfermera des renseignements sur les événements indésirables associés à la vaccination, qui sont les problèmes de santé faisant suite à une vaccination et qui ne présentent pas nécessairement des liens de cause à effet avec l'utilisation du vaccin. Les événements indésirables vont d'événements bénins courants, comme une douleur au point d'injection ou une légère fièvre, à des événements graves plus rares, comme une réaction allergique grave. Le Canada dispose d'un solide système de surveillance de l'innocuité des vaccins et tous les événements graves feront l'objet d'une enquête. Au 1er janvier, plus de 115 000 doses de vaccins contre la COVID-19 ont été administrées au Canada et 9 événements indésirables ont été signalés. Aucun problème inattendu d'innocuité des vaccins ne s'est posé à ce jour. Comme pour toute nouvelle entreprise, nous avons tous des questions. Les rapports hebdomadaires sur l'innocuité des vaccins contre la COVID-19 visent à ce que les Canadiens aient accès régulièrement à de l'information crédible qui les aideront à prendre des décisions éclairées en toute confiance sur la vaccination pour eux-mêmes et leurs familles. Comme toujours, nous invitons les fournisseurs de soins de santé à écouter les questions et les préoccupations des Canadiens et à encourager un dialogue continu pour inspirer la confiance envers les vaccins. Les progrès que nous avons réalisés au Canada et dans le monde entier en matière de vaccins sont inspirants, mais tout ce que nous avons accompli est le résultat d'efforts cohérents, soutenus et collectifs. Nous avons travaillé fort, nous avons tenu la cadence. Bien que nous sachions que nous attendons tous avec impatience de meilleurs jours, nous avons encore beaucoup à faire. Nous devons continuer d'adopter les pratiques de santé publique de base, se laver les mains, porter un masque ou un couvre-visage et limiter toutes les occasions de propagation de la COVID-19. En attendant notre tour d'être vaccinés, continuons à soutenir ceux qui doivent être protégés de toute urgence et faisons notre part pour aider tous ceux qui s'efforcent d'offrir un vaccin à tous les Canadiens dans les prochains mois. Merci.
Merci beaucoup, Dr. Njoo. J'inviterai maintenant le Major général Fortin à dire quelques mots.
Alors, merci beaucoup. Bonjour à toutes et à tous. We're pursuing a deliberate and phased approach to Canada's COVID-19 immunization strategy. This initial phase, or phase 1, is characterized by a limited and steady supply of vaccines for much of January, February, and March, before we see a significant ramp-up leading into April and the rest of the second quarter of the year. That said, we're working with our procurement partners and manufacturers to accelerate the delivery of approved vaccines as much as possible. As previously mentioned, a total of 6 million doses are expected to be distributed by end of March. Let me speak to Moderna and then Pfizer-BioNTech. Shipments of Moderna arrive every 3 weeks in this country. By the end of next week, 171,600 doses will be delivered, with numbers per provinces and territories similar to what we experienced with the last shipment. The first week of February, we anticipate another quantity, approximately the same, 170,000 doses. The quantities will begin to scale up to 250,000 in the month of February, and by end of March, we'll have 1.24 million doses delivered. So by the end of March, we expect to have distributed 2 million doses of the Moderna vaccines. So those are the numbers that we have today. We are working with Moderna to accelerate the availability of vaccines, and that also applies to Pfizer-BioNTech. Pfizer-BioNTech deliveries will continue on a weekly basis. This week, 124,800 doses were delivered. That finished today, and they were delivered to 68 different vaccine delivery sites across the nation. For the remainder of January, we expect approximately 208,650 doses to be delivered to the provinces weekly. In February, we expect to receive between 366,000 and 367,000 doses of the Pfizer-BioNTech vaccine per week. Shipments in February include, therefore, a 60,000 doses more per week than we originally planned, and represent an advance on Canada's March allocations. So the total expected of Pfizer in February is 1.4 million doses. So we're working with our procurement partners and the manufacturer to confirm Pfizer-BioNTech allocations for March. And by the end of the first quarter, we'll have received at least 4 million doses of that vaccine. As our collective understanding of these new vaccines evolves and the manufacturer update their product monographs and instructions, we're able to adapt how and where we distribute and administer vaccines to Canadians. Within the past week, Pfizer-BioNTech has updated their guidelines and procedures for the transportation of their vaccine in a thawed state and in smaller tray sizes. So this means that more options for that vaccine to be transported and administered to more sites and in smaller amounts, and that helps tremendously provinces in the administration of the vaccine. This complemented with our inherent flexibility to deliver to an increased number of vaccine delivery sites across the Canadian landscape, as identified by the provinces, and our growing capacity to support multiple cold chains is very good news. The allocation forecast will continue to fluctuate on a regular basis. This is an expected result of ongoing and persistent efforts on the part of Government of Canada to work with manufacturers to accelerate the availability of approved vaccines and of natural disruptions that can occur during the vaccine production process. We'll update our federal, provincial, territorial, and Indigenous partners and the public regularly on allocation forecasts as they evolve. So we'll continue to work together with all our partners to ensure that we have collective capacity to immunize as rapidly as possible and as safely as possible. Maintenant, en français, nous poursuivons notre approche délibérée et par phase de la stratégie de vaccination contre la COVID-19 du Canada. L'étape initiale, la phase 1, consiste en un approvisionnement limité et constant de vaccins pour la majorité des mois de janvier, février et mars, avant de connaître une augmentation accrue des doses au début du deuxième trimestre, en avril. Nous travaillons donc avec nos partenaires en approvisionnement et les fabricants pour accélérer la livraison de vaccins homologués autant que possible. Comme mentionné précédemment, un total de 6 millions de doses est donc attendu d'ici la fin ou le 31 mars. Je vais parler premièrement de Moderna et ensuite en détail de Pfizer-BioNTech. Alors, les envois du vaccin de Moderna arrivent tous les 3 semaines. D'ici la fin de la semaine prochaine, on s'attend d'avoir livré 171 600 doses, dont le nombre par province et territoire seront semblables au dernier envoi. Nous prévoyons aussi livrer à peu près la même chose, 170 000 doses de ce vaccin au cours de la première semaine de février. Les quantités du vaccin de Moderna commenceront alors à augmenter. Elles devraient atteindre environ 250 000 doses d'ici la fin février et 1,24 million de doses à la fin mars. Par conséquent, nous prévoyons avoir distribué un total de 2 millions de doses du vaccin Moderna d'ici le mois d'avril. Nous continuons de travailler, bien entendu, avec Moderna afin d'accélérer la disponibilité de vaccins et nous continuerons d'informer à mesure que les chiffres sont plus stables. Maintenant, sur Pfizer-BioNTech, les livraisons du vaccin se poursuivent à chaque semaine. Nous avons livré cette semaine 124 800 doses du vaccin à 68 sites de livraison à travers le pays. D'ici la fin du mois de janvier, nous attendons à livrer environ 208 650 doses aux provinces chaque semaine. En février, nous attendons à recevoir entre 366 000 et 367 000, dépendant de la semaine, doses du vaccin de Pfizer-BioNTech à chaque semaine. Les envois que nous recevrons en février comprennent donc 60 000 doses de plus que ce que nous avions initialement prévu pour le mois de février. Alors, c'est une avance sur l'allocation prévue pour le mois de mars. Le total attendu, donc, de Pfizer-BioNTech en février est de 1,4 million. Nous travaillons avec nos partenaires et les manufacturiers pour confirmer les allocations de Pfizer-BioNTech pour le mois de mars. Et d'ici la fin de ce premier trimestre, nous aurons donc obtenu au moins 4 millions de doses du vaccin Pfizer-BioNTech. En ce qui a trait au transport du vaccin, à mesure que nous avons une meilleure compréhension de ces vaccins et que les fabricants mettent à jour les monographies et les instructions sur leurs produits, nous pouvons mieux déterminer de quelle façon et dans quelle région nous distribuerons le vaccin aux Canadiens et comment nous organiserons son administration avec les provinces. Au cours de la dernière semaine, Pfizer-BioNTech a modifié les directives et les procédures de transport de son vaccin à l'état dégelé, ce qui est organisé en plus petite quantité et ce qui permet de faciliter le transport. Ça nous permet donc de transporter les plus petites quantités plus facilement vers les endroits, où les provinces seront en mesure d'administrer le vaccin. En plus de la flexibilité que nous avons de faire la livraison à un nombre accru de sites de vaccins dans toutes les régions du pays et de renforcer notre capacité d'appuyer les chaînes de froid, les modifications apportées par le fabricant sont une très bonne nouvelle pour les Canadiens et permettent de mieux gérer la stratégie de distribution du vaccin. En ce qui a trait à la fluctuation des doses, les prévisions d'allocation continueront de fluctuer régulièrement. On s'attend à ce que ça arrive car le gouvernement du Canada poursuit ses efforts et travaille de façon continue et incessante avec les fabricants afin d'accélérer la disponibilité des vaccins approuvés. Les prévisions d'allocation peuvent certainement fluctuer à cause des changements qui peuvent survenir durant le processus de production des vaccins. C'est quand même un nouveau vaccin. Nous informerons régulièrement les partenaires au niveau fédéral, provinciaux, territoriaux et autochtones, ainsi que le public des prévisions d'allocation au fur et à mesure de leur évolution. Alors, en conclusion, nous continuons de travailler avec tous nos partenaires pour nous assurer de notre capacité collective, ensemble, de vacciner rapidement, de mettre les vaccins à disponibilité des provinces et territoires afin d'obtenir des résultats le plus rapidement possible. Je vous remercie.
Thank you, Major General Fortin, for this excellent summary and this encouraging news. I would like to invite Dr. Sharma to speak. Dr. Sharma est la conseillère médicale en chef de Santé Canada.
On va absolument commencer avec des questions. Merci pour les discours. On va commencer avec 3 questions par le téléphone et on va retourner à la salle. Première question.
Merci. Thank you. Please press star one if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. Notre première question est de Madeleine Blais-Morin de Radio-Canada. À vous la parole. Please go ahead.
Oui, bonjour. Quand vous parlez de l'objectif de septembre 2021 pour la vaccination des Canadiens, j'aimerais que vous soyez précis, s'il vous plaît. Est-ce que ça veut dire que le Canada va avoir les doses nécessaires pour vacciner l'ensemble des Canadiens ou est-ce que ça veut dire plutôt que le Canada aura vacciné l'ensemble des Canadiens?
Madame Anand.
Thank you so much. I hope you can hear me. The numbers that we have been providing, and in particular, our procurements of a minimum of 214 million doses and a total of up to 398 million doses with options are dependent upon Health Canada approval of certain vaccines. We know that Health Canada has approved Pfizer and Moderna. We know that 2 additional vaccine candidates are in rolling review with Health Canada, being AstraZeneca and Johnson & Johnson. And so the numbers that we are using for our predictions are based on the assumption that the vaccines that we have procured will indeed be approved by Health Canada. Je voudrais aussi ajouter qu'il y a beaucoup de travail à faire avec les fournisseurs pour assurer qu'ils peuvent donner l'information nécessaire à Santé Canada pour l'approbation. Et nous travaillons fort avec les fournisseurs en ce regard. Merci beaucoup.
C'est Dr. Njoo. Peut-être je peux ajouter quelque chose aussi de la perspective de santé publique. Je pense que la question, c'est vraiment visé sur le point qu'on est sur le bon chemin pour être capable d'offrir les vaccins homologués à tous les Canadiens qui sont éligibles pour les vaccins homologués d'ici à la fin du mois de septembre. Pas forcer, la vaccination, c'est toujours une question d'offrir, être capable de dire aux Canadiens, on a les vaccins, on encourage les Canadiens à être vaccinés, mais on ne peut pas forcer. Ce n'est pas une question de vacciner, c'est toujours une question d'offrir la vaccination. Merci.
Suivi.
Pour que ce soit vraiment clair pour moi, est-ce que à partir de septembre, on va avoir la possibilité de vacciner tous les Canadiens ou est-ce qu'à la fin de septembre, on va avoir vacciné tous les Canadiens qui le souhaitent? C'est parce qu'il peut y avoir une différence. Est-ce qu'à la fin de septembre, on a les doses nécessaires ou à partir de la fin de septembre, on va avoir vacciné ceux qui veulent? Il y a une différence entre avoir les doses et avoir vacciné les Canadiens.
Oui, c'est vrai. Et merci pour la question. Je voudrais commencer par dire que, à mon avis, c'est nécessaire de penser à cette opération dans 2 phases. Premièrement, nous devons avoir les doses ici au Canada. Et aussitôt que possible, nous allons donner ces doses aux provinces et territoires. Ça, c'est la 2e phase. Et par l'avis du gouvernement fédéral, nous assurons que les doses vont arriver ici au Canada et donc les provinces et les territoires doivent faire leur part dans l'opération. Et peut-être le major général Danny Fortin veut ajouter quelque chose ici aussi.
Certainement. Merci, Madame la ministre. Je pourrais vous dire que j'ai confiance que, premièrement, les quantités vont augmenter d'une façon significative à partir d'avril en montant pour ce qui est des vaccins homologués. Bon, il y a d'autres vaccins qui peuvent devenir disponibles lorsqu'ils seront homologués, mais moi, je travaille avec le concret des vaccins homologués. Les quantités prévues vont augmenter d'une façon significative lors du prochain trimestre. Maintenant, les provinces, les territoires sont en train de développer une expertise pour ce qui est de la manutention et de l'administration de vaccins qui sont plus exigeants, plus complexes que ce qu'on a connu par le passé. Mais cette expérience, ces connaissances sont en train d'augmenter à tous les jours. J'ai aucune raison de croire, certainement c'est partagé parmi mes collègues, aucune raison de croire que en fait, j'ai les raisons de croire que les provinces et les territoires vont augmenter d'une façon significative leur capacité d'administrer des vaccins au cours des prochaines semaines et mois. Et puis, ensemble, parce que c'est un travail d'équipe, ensemble, on va continuer de regarder comment on peut prioriser l'équipement qui va faciliter cette administration au niveau des provinces et des territoires, redistribuer au besoin cet équipement pour couvrir les endroits où on a peut-être des points de vulnérabilité, ainsi qu'encourager le partage de meilleures pratiques et d'utiliser au maximum le contrat fédéral pour ce qui est de distribution pour faciliter la vie des provinces et des territoires autant que possible.
Je très brièvement, Madeleine, que la question est évidemment très pertinente. Et comme on a vu au cours des derniers jours, il y a un arrimage de plus en plus étroit entre ce que le gouvernement canadien a comme responsabilité de livrer les vaccins et les responsabilités des provinces et des territoires d'administrer ces vaccins. Alors, cette collaboration est de plus en plus forte, comme le premier ministre Trudeau l'a souligné, et on s'attend, comme le major général Fortin l'a dit, à ce qu'il y ait peu d'enjeux pour que ces deux exercices se fassent correctement en parallèle.
C'est Dr. Njoo, peut-être. Oh.
So I'll repeat this quickly in English. I think we have no reasons to doubt that provinces and territories will significantly ramp up their ability to administer vaccines over the next weeks and months as we collectively gain more knowledge and experience with administering vaccines, and certainly our role in terms of distributing at scale to those more remote areas. So provinces and territories can leverage a federal logistics service provider contract to maximum extent. We can prioritize distribution of cold chain enabling equipment, freezers, and all these other things that will help the provinces and territory to administer at scale. And as more and more vaccines become available, it's important to encourage sharing of best practices, and that's already ongoing with the conversations that we have amongst all key partners.
It's Dr. Maybe I'll just add a bit of a public health perspective. I think that the question about, what happens by the end of September, I think, we are vaccinating people right now, obviously, in the priority populations. And I think as more and more Canadians become vaccinated throughout the country, confidence will grow. People will see, a neighbor, a friend, a coworker is getting vaccinated. And so as, the summer months roll on, by the time we hit September, hopefully, like I said, there's just be a few more pockets in terms of Canadians who, for whatever reason, have not taken up the offer yet. And then we'll still obviously reach out to offer the vaccination to those remaining Canadians who are obviously eligible to get vaccinated. So I think that's the overall game plan. And to date, obviously, the federal government is working very well with our provincial and territorial counterparts, and things are unfolding as Major General Fortin has said, and I think it's only going to unroll even faster and better as we proceed further. Thank you.
Next question, please.
Thank you. Merci. Our next question is from Ryan Timothy from the National Post. Please go ahead. À vous la parole.
Yeah. Hi there. I was hoping to get a little bit more clarity around this September goal. My understanding is that you expect Pfizer and Moderna to deliver their combined 60 million doses by September, which I think would cover off the vast majority of Canadians who want a vaccine, especially factoring in that people under 18 can't currently receive it. It's not approved for them. Is that correct? Are you expecting to have all of those Pfizer and Moderna vaccines here by September?
I'll start with that. Thanks, Ryan. Nice to hear your question. I will say that our thinking in terms of providing the data to Canadians is based on the expectation that we will have additional vaccines approved. And so the numbers that we've provided take into account a number of vaccines, not only the Pfizer and Moderna vaccines. By the same token, we wanted to be sure that we would be able to have approved vaccines in place to ensure that Canadians can be vaccinated. And that's one of the reasons why we moved to exercise those 20 million additional Moderna options prior to the holidays. And so it's really a multi-pronged approach to make sure that we have vaccines in place for all Canadians this year prior to the end of September.
Follow up, Ryan?
Yeah, so I'm still not clear, though. Do you expect the 60 million doses from Pfizer and Moderna to be delivered by September as part of this goal of vaccinating everyone who wants a vaccine by September? And also, I guess, wondering if you can give us an update, too, on where we are at with the approval. If these vaccines are key, where are we at with the approval for AstraZeneca and Johnson & Johnson?
Okay, well, I will take the first question since I'm not Health Canada, and it's difficult for me to provide an update on the regulatory process, given that I'm not involved in it. But in terms of the Pfizer and Moderna numbers, yes, in large part, we are planning that Pfizer and Moderna doses will comprise the number of doses required to make sure that any Canadian who wishes to be vaccinated will be vaccinated by the end of September. Again, we are in conversation and negotiation with the vaccine suppliers, with Pfizer and Moderna every day. I have spoken with the CEOs of both companies this week already, and I will continue to engage with them, as will my department, to move up doses from Q3 to Q2, from Q2 to Q1. We are pressing on all fronts to do whatever it takes to make sure that we have vaccines in this country as soon as possible.
Thank you, Minister Anand. I am not in the room and therefore cannot see if Dr. Sharma would like to provide precisions on the regulatory process.
I would. Thank you very much, Minister. So this is SUPRIYA Sharma from Health Canada. So the question is regarding the rolling reviews of both the Johnson & Johnson and AstraZeneca vaccines. So both of those are under review. They are prioritized, expedited reviews, and the teams are actively working on them. We're also working internationally with our counterparts on those reviews. With respect to the Johnson & Johnson review, we are expecting some key clinical information coming in from clinical trials that are expected to read out around the end of January or into February, but that's been a little bit variable. And we also need some key manufacturing information. So there are still large chunks of information on that submission that we're expecting. With respect to AstraZeneca, we have done a review of the data that we have so far, and we are working with our key regulatory partners, including the European Medicines Agency, as well as the US FDA. And there are still some clinical questions that we need to look into. So on the safety side, on the efficacy side, as well on the quality side, on the manufacturing side. There is a large AstraZeneca study that's ongoing in the United States. and we still are expecting to get some information from that study. So that's almost 40,000 participants. So the reviews are progressing. They're progressing well. As we said, we're working very closely with our international partners, but there's still some questions to be sorted through before we make a final decision. As we get closer to making the final decision, absolutely we'll share that information.
Okay, we'll take one more question on the phone and then turn to Ron.
Thank you. Notre prochaine question est de Catherine Lévesque de la presse canadienne. À vous la parole, please go ahead.
Oui, bonjour tout le monde. Ma première question, c'est pour le major général Fortin. Juste pour le bénéfice là, de mes collègues à la radio et à la télé, bon, je comprends que vous avez donné beaucoup de chiffres là, sur les livraisons à venir, mais d'ici la fin du mois de mars, je ne sais pas si vous pouviez juste me dire, on peut s'attendre à combien de doses au total de Pfizer et combien de doses là, au total de Moderna, si vous pouviez répondre en une phrase là-dessus. Et est-ce que vous avez eu une indication que ces chiffres pourraient augmenter de façon substantielle dans la phase 1? Merci.
Oui, alors, je fais rapidement mes mathématiques en public. En février, c'est 1,4 million de doses de Pfizer. Et puis, d'ici la fin mars, on s'attend d'avoir atteint le 4 millions de doses de Pfizer. On s'attend d'atteindre le 2 millions de doses de Moderna d'ici la fin mars également. Et étant donné qu'on a eu 170 000 présentement et 171 000 la semaine prochaine, alors il y a environ 1,65 million de doses qui s'en viennent au cours des 2 prochains mois.
OK, suivi.
Oui, merci beaucoup pour ces mathématiques. Et puis, ma question suivie, c'est pour vous, M. Duclos. Bon, je voulais la poser à M. Leblanc, mais il n'est pas là. Alors, je me permets de vous relancer sur ce 1 000 $ là, pour les voyageurs là, qui a causé la controverse. Là. Le gouvernement a dit qu'on allait avoir des nouvelles pour changer la loi d'ici la fin de la semaine. On est vendredi, alors je me demandais, est-ce que vous avez quelque chose à nous annoncer aujourd'hui? Et sinon, où en êtes-vous là, dans les discussions là, pour modifier la loi sur la prestation?
Bien, merci beaucoup pour la question. Je pense qu'il est probablement inutile de rappeler, parce que tout le monde comprend maintenant le contexte, que cette prestation ne devait pas et ne sera pas accordée à des gens qui ont enfreint les directives de ne pas voyager à l'étranger et donc que cette prestation ne soit pas disponible pour ces personnes. Ce qui est clair et ce que je rappelle, c'est que cette prestation va être modulée de manière à ce que ces gens à la fois ne reçoivent pas cette prestation et que ça puisse être fait d'une manière appropriée d'un point de vue législatif. Et c'est pour ça qu'à la fois ma collègue, la ministre Qualtrough, et le leader en chambre, le ministre Rodriguez, travaillent déjà non seulement au sein du gouvernement canadien, mais aussi en collaboration avec les autres partis pour voir comment, dans un contexte de gouvernement minoritaire, on peut procéder pour faire les changements nécessaires. Mais à nouveau, le message principal que M. Trudeau a très bien rappelé il y a quelques jours à peine, c'est que ces gens ne recevront pas la prestation canadienne de maladie pour la relance économique.
Okay, we'll start with questions in the room. Mackenzie?
Hi, Mackenzie Gray with CTV News. My first question is for Major General Fortin, and if Minister Anand, you want to chime in, I'd like to hear what you have to say as well. A number of provinces are saying that they're going to run out of vaccines soon. Major General, you've said today, too, that the provinces can expect, or you expect that the provinces will be able to significantly ramp up their ability to give out vaccines. So do you agree with the assessment of Premier Ford that Ontario, for example, is going to be running out of vaccines soon?
Thank you. I think
I'll start. If
Go
that's
ahead.
okay, Danny, and then I'll turn it over to you. I want
Go
to
ahead,
start,
Minister.
Mackenzie, by saying that we are all pushing in the same direction. We are all cognizant of the fact that this is the largest mass vaccination program in Canadian history, and that I'd like to say that the province's work to date, especially over the past week, has been impressive as they work to increase their own capacity to administer vaccines. It's important to remember also, from a federal procurement perspective, that we have been clear with our delivery schedules We have been clear that we will be ramping up with the doses that we are delivering to the provinces. In fact, we will be doubling the vaccine deliveries from January to February alone. This is information that the provinces have and that they can use for their planning purposes. So the phrase running out of vaccines has to be taken into that in that context. That is that the schedule is in existence, it has been shared with the public and the provinces, and the planning should take place on the basis of that schedule. And now I'll turn it over to Danny Fortin.
Thank you, Minister. The only thing I would add is that we're working very closely with provinces and territories, of course, and we're providing as much visibility as possible. Our numbers are their numbers. They have visibility on what's coming in January, both January and February, and can plan accordingly.
So it seems like we won't be running out. It's just that we'll have more capacity to be able to do dole out vaccines compared to the number of vaccines that we'll have. That seems to be the point that you're making. But I'll ask my follow-up question for Minister Anand. Israel has, I think, 1.6 million doses of the vaccine, and that's in large part because they paid a premium price for it. They've come out and said that they've paid $30 a dose. The Americans have come out and said that they paid $19 a dose for Pfizer. Is the reason that Canada doesn't have nearly the same number of vaccines as Israel, a smaller country than us, who signed a deal much later than Pfizer with us, is because we were not willing to pay the premium price that Israel paid?
Thank you, Mackenzie, again for that question. I want to start by saying that we put everything on the table with the vaccine companies in our negotiations with them. And so the short answer to your question is we did put price on the table, of course, as well as a number of other factors. And it is as a result of our very strong position at the negotiating table that we were able to sign with Pfizer and Moderna first, that we were at the front of the line for Pfizer and Moderna, that the chair of Moderna came out and said we are at the front of the line for Moderna. And in my conversations with these companies every day, that point is clear, that Canada is a jurisdiction that they are serving and servicing, and we will continue to work with those suppliers to accelerate deliveries earlier and earlier in 2021. That is the work that I am doing and the work that my department is doing every single day.
Tonda?
Hi, I just want to come back to the idea that the provinces say at least 4 of them have come out and publicly blamed the federal government for their fluctuating and unclear numbers and the inability to plan properly and to get the doses out. So what is the problem? Is it that the provinces are overbooking vaccinations and that they don't have vaccine for, that you've told them what their numbers are and you've delivered? Have you ever not delivered the doses you said you would deliver them? What's the problem?
I will start and then hand it over to Major General Fortin. We have been very clear with the provinces and territories about the numbers of vaccines that we are procuring and that are arriving in this country. We continue to share those tables with them in a very collaborative way, and we will continue to do that because we need to work collaboratively to ensure that Canadians are vaccinated. I will now turn it over to General Fortin because he is on the front lines with the provinces and territories every day.
Thank you, Minister. Thanks for the question. I think back in mid-December and December, we certainly had a number of uncertainties, and there's a number of factors at play here. But there were a number of uncertainties, and when vaccines become regulatory approved, and we have more fidelity on the stocks available by the manufacturers, we're able to build a solid plan. we've been working with a number of assumptions and sharing planning data in full trust and confidence with provinces and territories. But we are now in a position to share a lot more. As you got from my statement, we have visibility on January and February, like solid numbers to work with, which will be tremendously helpful now to provinces and territories. So they have a lot more line of sight, predictability. More equipment is also being distributed at a pretty steady pace to ensure that we have an ability to administer down to to move down to the last mile and administer by provinces and territories.
If I may add a very brief additional remark. As the Prime Minister said this morning, this is the largest and most complex immunization campaign ever seen in this particular country. So there is, and there is still going to be some unknown and some uncertainty. But as the Prime Minister repeated again, this is a whole of Canada campaign. We are going to increase even more our collaborative capacity with provinces and territories to make sure that this is the success that Canadians expect and Canadians will obtain.
Okay, we'll go to the phone for one more question and come back to the room. Oh, sorry, my mistake, Tonda, go ahead.
Thanks. So maybe you could help me understand, and I still don't have an answer to the fact that why then are places like the University Health Network saying that they've run out and they've got 3 more days of appointments booked for people to get vaccinated, but they don't have vaccine. What's happening there? Are the provinces or those facilities overbooking when they don't have vaccine in hand? Is that what's going on?
Major General Fortin?
Yes, thank you. Well, I can't comment about Ontario's immunization plan or University Health Network bookings and plan. But what I can tell you is this: we provide as much clarity, as much visibility as possible on the doses available as we firm up those numbers with the manufacturers. And it's a collective effort, and we're very much in daily conversations with provinces and territories. The ramp up can be difficult because there's a desire to immunize at scale. The vaccines are coming. We've said all along 6 million doses between when we started in December to end March, and we're providing as much clarity as possible so that planners can plan as effectively as possible and immunize as rapidly as possible all Canadians who want the vaccine.
Okay, and now we'll go to the phone for one last question, then back to the room for one last. Thanks.
Thank you. Our next question is from Jaela Bernstein from CBC News. Please go ahead. À vous la parole.
Hi, I believe this question is for Dr. Sharma. Quebec Public Health is saying that the first dose of the Pfizer vaccine is actually around 92% effective just after the first dose, based on its interpretation of the data, though it has acknowledged it doesn't know how long that protection will last. But I haven't seen that 92% number anywhere else. And in fact, I've seen the FDA cautioning against interpreting the numbers that way. I'm just wondering how public health is interpreting the effectiveness of the first dose.
Thanks. It is SUPRIYA Sharma. Thank you for that question. So in terms of the effectiveness of the vaccine before the second dose, I think the first thing to really make sure that we stress is that this is both the Pfizer and the Moderna vaccines are 2-dose vaccines. So in terms of getting to that peak effectiveness levels, you do need the second dose. And depending on which vaccine, it's either after 3 weeks or after 4 weeks, and it's either measured 1 week after that second dose or 2 weeks after that second dose. The difference in the numbers in terms of what the effectiveness of that interim period is, so between the first and second dose, depends on when you're making those calculations. So again, this is a little bit of detail, but with Pfizer, we've said that before the second dose, so after the first dose, it's got a 52% efficacy. whereas some people have done the calculations and have read either that same data set as 89% or 92%. And the difference in terms of those numbers is because some people, when they do the calculations, take out the first 2 weeks after you get the first dose. So basically they're saying, wait, that's not fair to be doing an assessment of the effectiveness of the vaccine for that whole time period because we know it's not instantaneously effective. We're going to take out, depending on the way that they've done it, the first 10 days, the first 12 days, the first 14 days. So you'll see different levels of effectiveness based on how those numbers are assessed. It's really important to note that the studies were not designed to look for that sort of information. So this is a bit of a back of the envelope calculation on that. The other part of it that I wanted to just raise is that I think a lot of people are interpreting the efficacy, the effectiveness of the vaccine as sort of, if somebody gets the vaccine, you can take a blood test and you say you're at 95% or you're at 89% or you're at 52%. That's not really the case. The effectiveness of the vaccines are measured based on how many cases you see in the group that did not get the vaccine versus how many cases you saw in the group that did. So if you're talking about a 3-week period for Pfizer between the doses or a 4-week period between the doses in Moderna, if you take out those 2 weeks in the front end, you're really only looking at 1 week for one vaccine and 2 weeks for another vaccine. And so that's a very short period of time to be looking for cases. So the last piece is that when we look at those other calculations, so the 92% or the 89% effectiveness for those vaccines before those doses, it really is kind of based on, as we said, those calculations, and we don't know what that really means. Does it mean that that likelihood of not getting the disease continues for a long period of time, or is it something that's short-lived? So, I think both the assessments are appropriate. There's different ways of looking at the data, but the bottom line is these are 2-dose vaccines. You should get the second dose. The second dose should be as close to the approved schedule as we can. And the way that we know about the 95% or the 94% effectiveness is really based on getting that second dose, and we're still monitoring to see how long that effectiveness lasts.
Follow-up?
Minister Anand,
Yes,
would you like to add some precisions?
A follow-up
yes,
question.
Thank you, Jean-Yves. I'd just like to add something to Dr. Sharma's remarks. From a procurement perspective, the issue of the second dose has arisen in our conversations with both Pfizer and Moderna. And it is very important to remember that the recommendation from the manufacturer based on the clinical trials, and I assume their conversations with Health Canada, is that the second dose should be administered as instructed and should not be unnecessarily delayed. It's important from a procurement perspective to remember also that as we press for additional deliveries on an accelerated basis, we need to be able to show to the vaccine companies that Canada is indeed following the instructions that a second dose be administered in a certain time frame. So there's not only a health consideration, one ably expressed by Dr. Sharma just now, but there is also a procurement consideration that we need to take into account. Our arguments for accelerated deliveries are stronger if we can show the vaccine suppliers that indeed Canadian provinces and territories are following the instructions for the delivery and inoculation of the second dose that they have provided. Thank you.
Back to you on the phone.
Thanks. And a follow-up also for the minister. This is a question about disposable gloves. Our colleagues at Marketplace have been investigating the disposable glove industry in Malaysia, and they've been able to confirm that there are serious human rights violations, labor violations at some of the factories there. and experts are saying that there's strong indicators of forced labor. Millions of gloves from there are imported here to Canada, and some of the importers have federal contracts. And we know that these gloves are being used by hospitals here in Canada, by doctors and consumers as well. So the U.S. has recently banned the import of some of these PPE products, but Canada has yet to do so. So we're wondering why Canada isn't taking any action to stop these goods coming into the country.
Thank you so much for the question. As someone who has fought for human rights for my whole life, I take this situation very seriously. Forced labor is a significant and unacceptable problem in global supply chains. And as soon as I was made aware of this issue, I have ordered and asked my team to look into it and to discern what do our contracts say, what was the actual relationship. Our contracts for gloves in large part proceed through Canadian distributors or intermediaries. And so I've also asked my team to be in contact with those distributors. And we are working with our suppliers to investigate these allegations, to verify that their supply chains are indeed free from forced labor. As I said, it's an issue that I take personally very seriously and am working on it as we speak.
Okay, we're going to go to the room. Go ahead.
Hello, Minister Anand. This is Maan Hamidi with the Canadian Press. I want to ask you again about the recent negotiations with Pfizer and Moderna. You said that you're always in contact with them, and you said the main focus is to ramp up the deliveries of the vaccine doses. Have you offered or paid more for vaccine doses recently to guarantee larger shipments of the vaccine?
Well, thank you so much for the question. And I just want to say that our negotiations proceed on the basis that everything is on the table. We leave no stone unturned. We have sorry, my video cut out there. We have to make sure that we convey to the vaccine suppliers that we will do whatever it takes to get vaccines into this country and to do so as early as possible. And so indeed, ensuring that we had vaccines into this country prior to Christmas did involve paying fair value for those vaccines. And again, we are all on the same page of the urgency of this situation. And we will stop at nothing to ensure that we get vaccines here as early as possible.
Thank you, Minister.
One thing I would add very shortly, in addition, and in support to what Minister Anand has said, is that we, as Canadians, we should always be both mindful and proud of the strong regulatory reputation that we have outside of Canada. The fact that our regulatory agency on vaccination is so strong and has such a good reputation also helps our ability to procure and to work with pharmaceutical companies. In addition, of course, the fact that we have a strong public health system, which reassures our partners outside of Canada.
Thank you, Ministers. My follow-up question is for Dr. Tam. You have said before that Canada tests about 5% of test swabs for genetic variants for the novel coronavirus. Do you think that's enough, given that what you've seen in other jurisdictions, especially in England, where things now almost are out of control?
We are doing genetic sequencing at a rate that's commensurate with a lot of countries and better than most. And we are rapidly increasing that capacity as well and providing that capacity to the province and territory so that your major provinces are able to do a lot of sequencing right now. And we are also then assisting with the smaller jurisdictions, the smaller provinces as well. So as I said, we're sequencing about 5%, and but also increasing our laboratory testing strategies, looking at broader surveillance, but as well as targeting different populations, such as travelers, such as super spreading events, such as if incidence is increasing, for example, in a jurisdiction, we get those samples so that we can sequence them to see if there's any variants of concern. So, I think, yeah, so much higher than some of other countries, actually. And we are able, as you've seen, to detect the UK variant, and we're looking very closely for the other variants of concern as well.
Okay, that's the end of the press conference for today. Thanks, everyone.
Hello.